Hi everyone, in this video, Elizabeth and I are going to demonstrate a reflexology-inspired foot massage and plantar fascia release that you can follow along with at home to help alleviate foot tension or pain.
Introduce your touch to your partner. I like to begin with compressions all along the foot using my thumbs. Try to keep your thumb as close to the rest of your hand. This is a position of power for your thumb and it helps reduce fatigue and the possibility of injury. I like to draw circles along the bottom of the foot to warm up the tissue. At the heel, begin to use a compress then straighten motion with your thumb as you slowly walk up the anterior line of the foot along the edge of the arch. This is the spine of the foot. Follow the lines created by the toes from the heel up toward the tip of the toe. You can switch which hand is cradling the foot and which one is doing the compressions. Using both hands, compress at the heel and start moving your way up the foot, bracing your thumbs so that they're almost pulling away from each other. This assists in stretching the fascia. My thumbs are hypermobile, not everyone's are, so be mindful not to bend your thumbs too far back. Press and rotate your hand in areas you felt tension, which could feel like gravel under the skin. Massage the outside of the heel. This point is to help relieve tension in the head and the sinuses. Begin to massage around the ankle. You can plantar flex your partner's foot by pulling their toes towards you with your other hand. Follow the lines of the metatarsal bones from the toes to the ankle. Compress below the toes. These are the heads of the metatarsal bones. Walk with your thumbs horizontally here. Follow this pattern while making your way down the foot, stopping where the foot begins to arch, which is called the transverse arch. Press deeply into the middle of the transverse arch. This area is a reflexology point for the diaphragm. This may cause your partner to take a deep breath in. Keep walking your thumbs down toward the heel. Press deeply where the arch ends and the heel begins. Trace along the heel. Repeat compressions to the spine of the foot up to the top of the toe. Begin massaging the toes, stopping to squeeze the toe beds before moving on to the next toe. Press down into the ankle again. Sweeping back, and add in any additional motions that you see fit, readdressing areas of tension that you'd like to return to. Here I'm returning to my partner's heel. Finish by gently rocking the foot and kneading it between your hands. Pull, stretch, and move on to the next foot.
Thanks to Elizabeth for that demonstration. I'm going to now demonstrate a plantar fascia release that you can do by hand to your partner at home. I know for some people that have been more inactive lately, this has been causing their feet to tighten up. This release I'm going to demonstrate for you can also be helpful for those with plantar fasciitis. You want to have your partner lying comfortably on their stomach. The plantar fascia is a thick and dense connective tissue that originates from the heel and then slips out to attach to your metatarsal heads. It helps to make up the longitudinal arch of the foot and acts as a spring for the foot, as well as helps the foot lift off the ground during toe off. A lot of points can be tender in the plantar fascia when it's inflamed, but I often find that the most tender points to be right under the metatarsal heads, right in the middle of the arch, and at its more medial attachment to the heel. I'm going to show you a simple technique I use to release the whole plantar fascia that you can adapt for your own use at home. You might want to have some lotion with higher oil content or massage oil to make this easier. I use a 50-50 mix of biofreeze and massage oil in my office. I start by applying some of the oil evenly across the bottom of the foot, and then begin kneading the plantar fascia with my thumbs to ease the person into the work and find any tender points along it. I'll spend a minute or two doing this, doing a mix of circular and longitudinal strokes along the entire plantar fascia. Next, I'll make a fist. Using the other hand to gently bend the ankle to stretch the fascia a little and stabilize the foot, I'm going to use the middle joints of my fingers that are in the fist to do moderately deep strokes from the base of the metatarsal heads down to the heel. I'm pushing into the bottom of the foot while I'm rolling the fist in an upward sweeping motion, using my wrist, slowly. You may feel some crunchiness in some spots in the fascia, which is connective tissue and is normal. I'll spend 1 to 2 minutes doing this. Usually by this point, the patient will have communicated the most tender spots to you. For the next phase, I'll protrude the second or third middle joint out of my fist to create a point. I'll now use this point to focus on the tender areas the person has communicated to me. Here, Elizabeth was experiencing discomfort in the medial edge of her plantar fascia, so I'm going to spend a significant time in this area. I'm going to repeat the same motion I did in the last step, but focus my force on the leading knuckle along the tender area. You're trying to ride that fine line between pain and feel good for your partner, so make sure you're always communicating with them. You can always back off if you have to. I'll spend anywhere between 5 to 8 minutes working the tender areas in this manner. It could be on the middle or the other side of the plantar fascia. Whatever the case, just remember to work slowly. Lastly, if they happen to feel a lot of tension or discomfort where the plantar fascia attaches to the heel, I'll do small semicircular strokes right where it attaches into the heel to help loosen that area, spending 2 to 5 minutes in this spot. So there you have a couple routines from Elizabeth and I that you can use to help someone at home get some relief in their foot. Thanks for joining us, and we'll see you next video.